This is a film about Section 17 leave. For all patients detained under the Mental Health Act, Section 17 leave needs to be granted before they can leave the hospital. Leave is an important part of the rehabilitation process for all patients. Decisions about Section 17 leave should be made by the multi-disciplinary team and be part of the care planning process. Although the decision to grant leave is one made by the detained patient's responsible clinician. Nurses will have discretion about permitting leave on each occasion, and this decision will always be made after a risk assessment. In this film, we will visit different scenarios where leave is granted, and we will also consider what to do when someone goes absent without leave, AWOL. The film will start by hearing from people who have been detained under the Mental Health Act, who will talk about their experiences of Section 17 leave. The Mental Health Act and Code of Practice outline duties, powers and guidance in relation to Section 17. In addition, there will be local policies that you will need to be familiar with, governing the use of Section 17 leave and what to do if a patient goes AWOL.
I wondered if you could just start by telling the people who are watching the film what it feels like to be detained in hospital, what it feels like to be deprived of your liberty.
It's not nice. You can't do the things you want to do when you want to do them. You have to depend on other people all the time, them saying you can do it.
It's desperately depressing. You need access to the likes of cigarettes if you smoke, or chocolate bars or anything, just to keep your morale going. And you're in close proximity with an awful lot of people who are particularly unwell, and it's sometimes you want to be by yourself or be away from situations where there might be friction, because a lot of the patients take drugs and there's drug deals and things going on, and it's really quite creepy. Well, I didn't have a change of clothes, I didn't have access to money, and I didn't have access to my mobile phone so that I could get in contact with people who are close to me, friends and family, or anybody else I had to get in contact with.
Humiliated. You feel absolutely humiliated. You feel powerless. You feel deprived of your liberty, and it's very difficult for you.
You do feel kind of restricted. And when you see other people, hitting the fire alarm, etc., the thought does go through your mind, but I've always kind of thought, no, I don't want to, because if I overstep my boundaries, then my parents won't be very happy, and etc., and I'll just be causing more harm.
It feels really sort of stuck, like somebody's taken away something from me, like my rights, just my freedom, my liberty, just everything, taken away my whole life and just sort of locked me away. Like if I've done something wrong, sort of to be put in a hospital against my will actually feels as though I've committed some kind of crime and been locked away, because that's what it feels like being in hospital when you can't leave.